Hi, everyone. Welcome, everyone. It's 101. We're going to get started. Thank you for joining us for the second session in our new series designed specifically for school nurses. Environmental justice and health equity is what we're going to be discussing today. Next slide. We're excited to spend this time together as we explore how environmental factors contribute to health disparities, especially among asthma sufferers, and how school nurses like you play a vital role in creating change. I'm happy to serve as today's moderator and proud creator and organizer of this Lunch and Learn series for school nurses by a school nurse. I've been in public health for a little over 15 years, and I'm also co-director of the UIC RN to BSN program. I'm really happy to be here. As a school nurse and public health advocate, I've seen firsthand how deeply the environment impacts our students' health. Poor air quality, exposure to pollutants, and unsafe housing conditions all play a vital role in chronic illnesses and disproportionately affect the communities that we all serve. That's why I've committed myself to advocacy, testifying at the state level, partnering with national climate coalitions, and working alongside nurses across the country to ensure that our voices are heard in shaping healthier, more equitable environments. Advocacy really is part of our care. Next slide. Here's our agenda for your review. We will end promptly at 1:30. Today's session will highlight the environment's conditions driving asthma disparities, communities most affected by environmental health risks, advocacy strategies that work at the local, state, and national levels. And we really hope that you leave today feeling empowered with actionable tools to advocate for healthier environments and to advocate for health equity in your schools and communities and to advance those. Let's get started, and thank you again for the work that you do every day to protect students' health. Next slide. Here's just quick housekeeping. You don't need to have your video on, and you can stay muted. This session is being recorded for those that are unable to join or stay the full time. You'll have access to the recording. Next slide. A little bit about the Chicago Asthma Consortium, CAC. The CAC is a leading coalition dedicated to improving the lives of people with asthma through education, collaboration, and advocacy. We bring together healthcare professionals, school staff, public health experts, and community leaders to advance policies and practices that reduce asthma disparities, especially in communities most impacted by environmental and social determinants of health. Our work centers on ensuring that every child, every family, and every neighborhood has access to the tools, resources, and care needed to manage asthma and breathe easier. Next slide. Here are ways that you can help. You can always help with volunteering. If you are interested, just reach out. Next slide. I'm happy to welcome Dr. Mimi Guiracocha, a public health nurse working for the American Lung Association as National Director of Health Systems Improvement. There, she leads a national asthma quality improvement program, partnering with primary care providers, clinics, and systems to improve asthma outcomes. Prior to this position, Dr. Hirakocha worked as a NICU nurse, advocating for all families to have equitable access to quality care. She has also worked with the Chicago Public Schools, CPS, to improve school management of chronic conditions for students. She is passionate about environmental justice and community organizing. Next slide. We're also joined by Susan Mudd, an attorney and senior policy advocate for the Environmental Law and Policy Center, that's ELPC, where she directs their diesel pollution reduction initiative to protect children's and community health. Susan previously served as Citizens for a Better Environment's Wisconsin director for 15 years. She has also done consulting for the Gaylord and Dorothy Donnelly Foundation and the Brico Fund. Please help me in welcoming Dr. Mimi Hiracocha. She'll now be sharing her slides. Thank you.
Thank you and welcome. I know that there's a chat that went out to just ask people to introduce themselves. So if you have a chance to do that, would be great to get to know who's in the audience. And thank you, Gloria, for the introduction. Mimi Wiracocha, I use she, her, ella pronouns, and I'm excited to talk to you all as school nurses, as someone who hasn't worked in school nursing, but who has worked with Chicago Public Schools before to do asthma management. That was what I did my doctorate was in asthma in schools and how we can utilize school clerks in the relationship as well with school nurses to be able to identify patients who have asthma. But now at the Lung Association, I help to oversee a program focused on health systems improvement in clinics, including school based health centers, and with school nurses or nurses who are working in schools to improve the quality of care that they provide their patients with asthma. So that's a little bit about me. Well, we're going to discuss today, hopefully, I'll be talking a little bit fast, is how air quality impacts health overall, disparities, some stories from the field, and some resources. And then I know that my co-presenter, Susan, will talk about some specific ways that you can get involved in some of the campaigns happening right now around the EJ environmental justice space. Now, this is maybe review for some, but I always find it exciting and interesting to learn more. So we are where we breathe, right? We're talking about the quality of air that we breathe. So if you didn't know, we take about 22,000 breaths per day, right? So that's a lot. And about 90% of our time is spent indoors. So especially with COVID, right? People work from home, and even if you're at a workplace or even if kids are at school, for example, right, they're typically inside, except for maybe if they have recess or they have lunch outside. And so a lot of our time is spent indoors. So I'm going to be talking a little bit about indoor air quality, but also outdoor air quality, of course, impacts that. Um, but it is important to know that indoor air pollutants may be two to even up to 100 times higher than outdoor air quality. And so if the air quality is poor, of course, our health is going to be impacted. So in terms of the different types of indoor air pollutants, and again, as a refresher, there's four different basically categories. Gas pollutants, which includes things like radon, carbon monoxide, biological pollutants, so that would be like your mold, your bacteria, your viruses, pollen, particulate matter, so dust from cooking, smoke, stuff like that, and then volatile organic compounds. So cleaning supplies, for example, would be one of those things. Alrighty. So now in terms of some of the health effects of poor indoor air quality or just air quality in general, right, which is why environmental justice is really important, especially in our schools, is that the health effects can be sometimes felt right away and sometimes it can take years for them. So a child is in school and impacted by potentially poor quality of air in their schools can have long-lasting effects into their adulthood. And we don't yet know exactly how long of an exposure or how much of a dose is needed to produce a specific outcome in their health. So I can't tell you, if they are exposed to, mold for a certain time of, a certain length of time at a certain dosage, they're going to develop XYZ thing. But it does obviously depend. There are factors in it. And short term, we see sometimes, you'll have eyes, nose, throat kind of scratching, irritated, maybe their heads will hurt, you'll get dizzy and fatigued. But long term, you can have things like asthma develop as a result of having poor air quality that you're intaking. You can have heart disease, you can develop cancer, right? Lung cancer, but also other types of cancers. So again, just going quickly through that as a refresher. Here are some specific poor air quality sources and their known health effects. So you can see that. In terms of lung health, but then also beyond that you see impacts to the central nervous system, you see impacts to behavioral issues, to your brain damage, potentially even stomach illness, upper tract infections. It can even cause lung cancer like asbestos, we know that. And So I just wanted to highlight some of these. And in schools, we can find any or all of these, right? We can find asbestos in schools. We can sometimes, have formaldehyde or mold, especially mold, right? And depending on the building, depending on the ventilation that's available. Is it an older building? That can be the same with lead, right? And I know that here, at least in Chicago, we still have schools that have some lead in their, plumbing and things like that. And so we know that that can really impact, especially kids, and air quality too. Carbon monoxide, cockroaches, mercury, all of these things have impacts. So just so that you know, and you'll be able to see the slides later too. And of course, the list goes on and on and on and on. Now, in terms of the effects that that has, we see effects at all ages of life, right? It's not just one age or one group, it is really all. So, whether the pollution is inside or outside, it impacts us from before we're even conceived to in the uterus to when we're newborn, all the way until elderly populations. And of course, even though it impacts everybody, there are certain populations that are more vulnerable. For example, right? Elderly people, individuals who might already have long-term health conditions. They might have defense systems that don't work as well, and they're less able to combat some of those effects of those pollutants that affect the air. Children, and I know a lot of school nurses. We're going to be working with that pediatric population. They take more breaths than adults. That 22,000 was probably for adults, right? Children breathe more per minute than do adults, and so if they're breathing more rapidly, they're absorbing more of those pollutants. They're also closer to the ground, right? And so their concentrations of pollutants also are higher at a lower level because of gravity. And so they're already at a higher risk than other individuals. Individuals who are pregnant also, right? And their babies are also in at risk for more adverse health outcomes as a result of poor air quality, and it can even lead to premature birth and to lung issues in those babies. And people with also pre-existing health conditions like asthma, right? You're here today with the Chicago Asthma Consortium. This is really, really special topic for them because air quality, environmental justice, or lack of justice really can also already uh, can impact already vulnerable populations that already struggle with asthma or COPD, lung cancer, maybe secondhand tobacco smoke or anything like that too. So it can make people's asthma worse as well. And I'll tell you some stories from the field in terms of how, medication management is not sufficient, right? Also, we have communities that may be living in low income housing that might have substandard housing. They also could live, especially communities of color. We already see this disparity. We know from our state of the air, even at the Lung Association, but also from literature and what is out there in terms of research, that people, who live closer to those pollution producing sources, whether it's interstates or highways, industrial corridors, areas with high traffic of like diesel emitting or diesel trucking, for example, they're going to also be more disproportionately impacted by air pollution, right? And that's going to lead to more missed days of school, more missed days of work, which then kind of maybe even keeps them in that low income um, kind of routine or other cycle. We also know that there's financial strains of medical costs that are associated with hospitalizations and ER visits if a person with chronic disease like asthma gets an exacerbation from just living, from just breathing, from just existing in their community that unfortunately doesn't have clean air. Right. And so, again, this is something that for me personally, as a public health nurse, as a nurse, as a human, is very near and dear to my heart because people should be able to breathe and to live and to play and to work and to study without just doing that impacting them negatively in all of the ways that we mentioned thus far. So, speaking a little bit more, bringing it home to Chicago or the kind of Chicagoland area, these are just some statistics that I pulled from the Chicago Health Atlas, as well as then I'm not sure if people are aware of here. Maybe I can make it a resource to share after. But the Chicago, there was an ordinance passed to do a cumulative impact study to kind of see what are the cumulative impacts of our environment as a pursuit of environmental justice for the city of Chicago, which has a long history of environmental racism, right? And so there was a map on the right that was created with a work group and scientists and the people from the from the city, who kind of created this map, and they looked at cumulative impacts. So not only, air pollution, but also asthma rates, proximity to highways, stress, right? Things that impact communities as a whole that makes them just more susceptible to environmental triggers, environmental air pollutants. And the right is kind of, it'll show the darker bluish, greenish is the areas that have those higher concentrations of maybe pollutants and all those things I mentioned. And those are what we are calling basically like our environmental justice zones or areas or EJ communities. So you'll see that is primarily focused on the southwest sides of the city. Now, on the left-hand side, you'll see this is pulled from our data in 2023 in Chicago, ED visits related to asthma for kids and youth, right? And we see how if we were to put those together, they would kind of match up. So we see clearly how environmental pollution, how environmental impacts on populations very directly are leading to increased visits to the emergency department for kids with asthma. Again, just highlighting that this is something that is happening that we want to fix, right? Something that we are being made aware of. And there's currently actually an ordinance, and I'm not sure if Susan will speak about it. If not, I'm happy to share at the level of the city to kind of take into account the cumulative impacts of communities when new manufacturing or construction of companies that may be polluting the air are trying to come into a community to be basically say like, actually, let's look at a cumulative impact, not just what your company is going to be doing here, but what's already in the air, what's already impacting the health and well-being of a community. And if you have any questions at any point, please put them in the chat. And thank you so much for those who introduced themselves, Kyle, Cassandra, and Natalie. Um, and I'm going to now skip over that slide and just share maybe for the next couple of minutes before Susan speaks on some stories from the field as a public health nurse working in the asthma space and the health system space and working with nurses all over the country. So one of the things that we do through our program, our Enhancing Asthma Care program, which is a quality improvement program, we partner with, again, primary care providers and clinics, whether it's in schools, in the community, free clinics, university, whatever, nursing faculty led, etc, and we do a quality improvement program around asthma where we teach them about guidelines, for example, right? We tell them, okay, here are the guidelines, here is the newest updates in terms of smart therapy, that's a single maintenance and reliever therapy. Here's an update on or how to do spirometry correctly, how to diagnose a patient, and also here are the appropriate medications that these patients need, action plans, how to fill them out, how to use them, all of those great things, right? That are guidelines based and evidence based things. And I will tell you, I have providers, I have nurses who are just so passionate about implementing those things. And this happened to me in New Mexico. I went there and I spoke to all their nurses. I did a little asthma basics and talked about the guidelines, and they were all excited. And then one of the nurses speaks up and says, we've been implementing some of these changes. However, kids keep missing school and end up in our clinic anytime the oil refineries turn on. And it was just very clear how, right, we know that clinical excellence can't offset poor environmental conditions, which is why you as nurses, me as a nurse, all of us as nurses, right, must advocate upstream for housing, for clean air, for equity, and for the ability for our guidelines to actually make a difference because medicine can't treat what policy and environmental injustice creates, right? So that's just a quick story of how they were trying to do their very best and it still didn't work. The other thing is here, closer to home here in Illinois, actually a pediatric clinic in Chicago in Lincoln Park. This is where, it just kind of made me think about this because they were talking about how they also speak with schools and things like that and nurses and people and their kids are missing classes. And you as a school nurses, where you come in, right, you're often the first to notice when an asthma isn't under control, right? Maybe a patient comes with an exacerbation. Maybe they're also just coming and they haven't come for their medication today. You're like, wait, they need their daily maintenance medication, and usually you're the one to oversee it or to administer it. But beyond managing systems, or symptoms rather, you as nurses can be really powerful advocates. Here in Illinois, we know that, right, everything's about, and all over the country, everything's about coverage and what's covered by your insurance, what's not covered by your insurance. Now, if you are aware or not, this is maybe getting into the weeds, but Flovent was discontinued in the beginning of 2024, I believe. Now, we're already a year and a half into that, and I had a clinic here in Illinois tell me that they're having issues and problems getting a substitute covered for patients. So they're having to scramble and see what they can put their patients on because what they were on before is not on the market, and what would be a generic equivalent is not always either available or covered. And so, um, this is something that we know is not something that they can do. It's not even something that I personally can do. I can't sign something into law. But again, you as school nurses, me, we can be powerful advocates that help to connect families, right? That we can document those recurring access issues and we can join other people, whether it's the CAC, whether it's the American Lung Association, whether it's your school nursing associations, for pushing for policy changes that can expand the coverage of evidence based medications so that your students, so that your communities, you yourselves can live healthier lives where you can thrive and be able to focus on what matters, right? Which is school and education for those students, work and livelihood for all of us. And knowing that nurses are not just caregivers, right? We are systems change agents. And maybe I'm speaking biasly from a public health nurse perspective, but you are doing the work of public health by being in schools and by seeing what community members are struggling with, what your students are struggling with, especially school nurses. You are the closest to those environmental patterns affecting students. And so your voice is powerful, your stories are powerful. Document those stories, right? Sign up for public comment, do the things that Susan's about to tell us right now, so that we can make a longer impacting change. Um, I'm sure the slides will go out, so you'll see more resources if you want them. And then, of course, my information is there as well. I'm going to hand it over to Susan to take us home, but thank you for your time.
Thank you so much, Mimi. Are my slides visible now?
Yes, they are.
Thanks so much. First of all, thank you, Mimi, for both the background on the environmental justice and health equity and the important connection and the important role that school nurses play every day for the health of your students and can play in the advocacy space, as Mimi alluded. So my name is Susan Mudd. I'm a senior policy advocate at the Environmental Law and Policy Center based here in Chicago. It's really a privilege for me to talk with you all today. I've had the opportunity to work with school nurses in Michigan on creating a session on a day in the life of a child with asthma and talking about the many different things that can impact a child. I'm only going to talk about a couple of things, given our time today, that you can do as advocates for your students. Mimi mentioned, and it's not in my slides, but I will mention right now, the Chicago's Cumulative Impact Ordinance. Mimi is correct. An ordinance has been introduced by the mayor. It has not passed the council, and we are among those working to get it passed. Your voices, contacting your older person, if you happen to live in Chicago, can be very helpful in getting your older person understanding the role of pollutants in your students' lives, how it impacts them, and what the city can do at the level of this cumulative impacts ordinance to address that. Now, my slides touch on three other things, but I'm glad to later send out information on the cumulative impacts ordinance that Mimi mentioned. Okay, so to advance the slides. I'm now struggling with advancing the slides.
You could try clicking on the screen.
Did that work?
Yes.
Okay, great. Okay, Mimi already discussed why that children are more sensitive. So in the interest of time, I'm going to move on. Mimi mentioned diesel as one of the sources of pollution that impacts children. I'm going to be talking about school buses, something that you see every day at your school. In Illinois, nearly 1 million children, school children, take diesel school buses to and from school every day. There's 23,000 mostly diesel school buses on the road here in Illinois. So children are exposed to some of those pollutants that Mimi mentioned, nitrogen oxide, small particulates, greenhouse gases. These can trigger asthma attacks and contribute to the problems that Mimi mentioned. Diesel exposure affects cognitive ability. And the ultimate irony is that students who use wheelchairs, whose health already puts them at making them vulnerable, are also doubly vulnerable when they ride school buses, because usually the entrance for a wheelchair is at the back next to the tailpipe. These are some of the pollutants that are in diesel and that our children are being exposed to regularly when they're riding these school buses. One very important work study that was done by the University of Michigan School of Public Health, led by Dr. Sarah Adar, found that getting kids out of old dirty diesel school buses could result in 14 million fewer absences from school each year. There's more in here, but in the interest of time, I'm going to be fast. This is a map that we've put together. We've been working for a few years now to help Illinois transition school bus fleets away from diesel to electric. Why electric? Because zero tailpipe emissions, so children would not be continually exposed to diesel pollution. This is a map of the school districts in Illinois that have already been awarded one or more electric school buses. This is the beginning of a slow transition. Not all of these buses are on the road yet. We can get into that if there's questions about the federal and state funding, but I want you to see there's hope and there's opportunities. This is a list of all the school districts in Illinois that have been awarded electric school buses. You can look for yours, and we're glad to talk specifics about the process. Already, and right now, ComEd, which is the electric provider for Northern Illinois, has specific rebates available for school districts who want to get electric school buses. So if you are working in a school district that is in ComEd territory, they can qualify for and apply for rebates to help get electric school buses, which are currently more expensive than diesel. But with ComEd's rebates and the rebates, what are called here the make-ready rebates that help with the electric vehicle infrastructure, these electric school buses in ComEd territory can now be at cost parity with diesel. So a big objection has been the price difference, but with ComEd's programs now, your school district could get electric school buses at cost parity with diesel. In Ameren territory, for those of you who are in central or southern Illinois, there are not rebates like this, but there soon will be programs to help on at least the infrastructure side. So coming to a school near you. There's tax credits that are currently available. You may say, Susan, school districts don't pay taxes. Why are you telling me this? Because school districts can qualify through something called direct pay from the IRA law. The current Congress may try to get rid of this, but so far this is still available. So school districts that get electric school buses can get these credits called direct pay, which can help reimburse for the costs. I'm going really quickly because of time. So that's the first action, is to try to get your school district to go for electric school buses for the kids' health and frankly the driver's health, and you nurses and other staff that stand by those buses when the kids are waiting for those buses and they're idling. Okay, the Alliance of Nurses for Healthy Environments, some of you may already be members, and even if you're not, it's a great organization, and they're now got this letter for health experts to write to Congress about the many, many rollbacks that the current administration is trying of the standards, the air pollution standards, which protect both kids and adults' health. You can click on it here. If it doesn't work, it's not going to work. We don't have time. So I'm going to go on to the next one. Sorry about that. One last issue is that right now on the Senate side at the US Congress, there's been what's called a CRA, a resolution to roll back protections that currently exist for 7 of the most toxic air pollutants that are now regulated. The Congress, the House, will be taking this up We don't have an exact date, but the details are in this fact sheet. If you're interested in not being exposed and not having your students exposed to mercury, lead, dioxins, PCBs, please urge your congressperson, your congressional representative, it's already been through the Senate, so your congressional representative, to not support these resolutions. Anyway, there we are. There's my email. Please contact me about any of these issues, including cumulative impacts ordinance. We'd really love to work with you on this and really appreciate your time today.
Thank you. Thank you so much. It is 1:30, so we will be ending. I just wanted to thank you, Dr. Guiracocha. Thank you, Susan. I second really quickly the Alliance of Nurses for Healthy Environments. I'm actually the current leader of the Midwest Committee, and invite you all to join me. And please share in the call to action that Dr. Guiracocha just put in the chat. And for the next event, if you could please also join me there. We'll be meeting on May 28th, and that's from 1 again to 1:30. And we'll be discussing indoor air quality and student health. Thank you again for attending. For all those that included or that you will include information from the chat as far as like the Google Doc that we just shared. I'll be able to see those with the rest of the CAC team, and maybe we can guide further Lunch and Learn series for the fall. But please join us for the next one in our 3-part series. Thank you, everyone. Have a good rest of your day. Bye-bye.